In this presentation, I'm going to start our discussion with the ankle and lower leg. There will be two presentations or two parts to this presentation. In this presentation, I'm going to provide an overview of ankle and lower leg anatomy. So we're going to start with our bones. And our first bone in the in the ankle and the lower leg is the tibia. This is the weight-bearing bones when we walk. And the bottom portion of the tibia, or the distal tibia, is on the medial side of your ankle, or the inside of your ankle. The bony part of the ankle where you think, well, that's my ankle. That's called a medial malleoli, or if there's two malleolus. Then we have the fibula on the lateral aspect of the ankle and the leg. And this is where we have muscle and ligament attachments. And the distal fibula, or the bottom of the fibula, is the lateral malleolus. Again, that's the ankle bone. That's normally what people think of the ankle bone. The other bone is the calcaneus, or the heel. And our last bone is the talus, also the talar. That's another way we're going to talk about is the talus bone. You can see in the red, it's a pretty big bone in our foot. And then in our lower leg runs from the ankle up to our knee. And again, we have the tibia again, which is the shin bone. It's on the medial side, or on the outside, the inside of our leg. And then our fibula is on the lateral, or the outside of our lower leg. So you can see in the picture that the tibia is much bigger than the fibula. Fibula is a pretty small bone. It's pretty long. You can actually feel the top of the fibula on the outside of by your knee. If you internally and externally rotate your lower leg while your knee is bent, you can feel it's called the head of the fibula popping in and out. And now we're going to talk about the ankle joint and some ankle ligaments. The ankle joint itself, the anatomical term, is the talocrural joint. It's made up of the tibia, the distal aspect of the tibia, and the anterior portion of our talus bone, as you can see there in the picture. And it does plantar flexion and dorsiflexion. So here's a little GIF that shows plantar, now the dorsi and plantar flexion. So dorsiflexion is when you're bringing your toes up towards your shin, and plantar flexion is when you're stepping down. I call it the stepping on the gas movement. So that's plantar flexion. Our next joint is the subtalar joint, and this is made up of the talus bone again and the calcaneus bone. So it's a pretty small joint, but this is where eversion and inversion take place. And so on the picture there, you can see the inversion is when you roll your ankle out, and eversion is when you roll your ankle in. Sorry, did it the wrong way. I'm flip-flopping today. I'm feeling pretty bad with my dyslexia. So inversion is bringing your foot in. That's how I tend to remember it. Bringing your ankle in is inversion. Eversion is bringing your foot or ankle. It's technically your foot. You're taking your foot out with eversion. Our lateral ligaments. First one, these are the ones that get sprained with an inversion ankle sprain. And the first one is the anterior talofibular ligament. Again, with anatomy, the name typically tells us where something is located. So this is on the anterior, or the front of the ankle, and it connects the talus to the fibula. That's the talofibular ligament. Again, a ligament connects a bone to a bone, and it provides some kind of stability for a bone or bones. For this particular ligament, what it does, it restrains anterior displacement of the talus, which means it keeps the talus from moving forward when we walk. And that's going to be important when we talk about ankle sprains. The calcaneal fibular ligament, or CF, it connects the calcaneus to the fibula, and it restrains eversion of the subtalar joint. So it doesn't allow too much eversion. If we go over hypereversion, that's when this ligament will get sprained. Our next ligament is the posterior talofibular ligament, or the PTF. So that's on the posterior or the back of the lateral ankle. And again, it connects the talus to the fibula, and it connects or restrains posterior displacement of the talus. So it keeps the talus from moving backwards or posteriorly. There's another group of ligaments that's called the anterior and posterior tibiofibular ligaments. Again, so they're on the front and the back ligaments, and they're between the tibia and the fibula. So these run connect the tib and the fib together. This is sometimes known as a syndosmotic ligaments, and it holds the tib and fib together. So every time you step down, the tibia and the fibula doesn't separate. On the medial ankle, or the inside of our leg, we have the deltoid ligaments. It's a group of several different ligaments, 3 of them, and they're shaped as a triangle. That's why they're called a deltoid, because that's the shape for the deltoid in Greek is a triangular shape. And what it does, its function is to restrain eversion of our ankle. We don't see this ankle ligament getting sprained too often. Now we're going to move on to our muscles and range of motions. So plantar flexion is done by our calf muscles, the gastrocnemius and soleus, and eversion is done by our peroneus longus, brevis, and tertius muscles, which are on our picture there. You can see that they are on the lateral aspect of our lower leg. And then dorsiflexion and inversion is done by the anterior tibialis, which is anterior on the tibialis side, the tibia side of our lower leg. That's the big shin bone, shin muscle right over your shin. If you do dorsiflexion, you should be able to see this muscle become prominent. It's the big muscle when you're doing dorsiflexion. It's the anterior tibialis. One thing I should have said about these peroneal muscles, when we do ankle sprains, when we have a lateral ankle sprain, a lot of times their peroneal group of muscles, the longus, brevis, and tertius, tend to get strained because they are stretched with the motion of inversion. The last thing we're going to talk about in the anatomy is what's called muscle compartments. In the lower leg, if we look at that picture, if we cut the leg in half and look down at in the muscle in the body, you'll see 4 compartments that are separated by tissue, called connective tissue. And we're going to talk about the 4 different compartments. The first one is anterior compartment, which is obviously the front of the lower leg. This contains our dorsiflexors, toe extensors, anterior tibial artery, and tibial nerve. Then we have the lateral compartment. This has the peroneus longus, brevis, and tertius muscles. The superficial posterior compartment. Superficial means it's closer to the skin, and that makes up of the gastrocnemius and the soleus muscles. And deep, which means it's deeper in the leg. It contains the foot inverters, toe flexors, posterior tibial artery, and the tibial nerve. So the reason why we're talking about these particular muscles or this compartment, because we're going to talk about an injury that has to do with this compartments. Quickly to review, in the ankle is made up of the tibia, the fibula, the talus, and the calcaneus bones. Our lateral ligaments are the ATF, PTF, and the CFL, the anterior talar fibular ligament, the posterior talar fibular ligament, and the calcaneal fibular ligaments. The medial ligaments are the deltoid ligaments, are different range of motions. We have plantar flexion, which is done by the gastrocnemius and soleus, dorsiflexion by the anterior tibialis, eversion by the peroneal group, peroneus longus, brevis, and tertius, and the inversion is done by the anterior tibialis. Now these are the primary movers. There are secondary and tertiary movers, but we're just going to focus on the primary movers. And that's it for anatomy. Our next presentation will talk about the injuries in our ankle and lower leg.